Hello, this is Dr. Nony, board certified internal medicine physician. Have you ever met someone who swore they tried everything under the sun to lose weight, but nothing worked? Let me introduce you to one of my patients. Let's call her Sara. Sara used to cry in my office, not from pain, but from shame. Because after every diet failed, she blamed herself. But what if I told you that her body wasn't broken? It was just fighting back the way nature designed it. And what finally helped her wasn't a fad diet or willpower. It was a hormone your body already makes it. And that's now being harnessed in one of the most powerful weight loss medications we have ever seen. Let's talk GLP-1s, the science, the myth, the side effects, and what you need to know. Sara is 39, a school teacher, busy, kind, active with her kids. She came to me with high cholesterol, borderline diabetes, and a history of yo-yo dieting since she was 17. She tried keto diet, Weight Watcher, intermittent fasting, personal trainers, and even weight loss hypnosis. She would lose about 10 pounds and then she would gain it back to 20. Not because she wasn't trying, but because her body was wired to resist weight loss. And let me tell you, willpower is stronger than biology. So when she came to me, we talked options. And I brought up a new class of medications she had never heard of, GLP-1 receptor agonists. She was skeptical at first, and she asked me, isn't that Ozempic? Is that just for diabetes? I said yes and no. Because what we have discovered next would change her life and how we think about obesity entirely. So when you eat, your body releases a hormone called GLP-1, glucagon-like peptide 1. Its job is to signal your pancreas to make insulin, slow down how fast food leaves your stomach, tell your brain you're full, reduce cravings, especially for junk. But people with obesity often have damped GLP-1 signaling. Their fullness signal is weaker, their cravings are stronger. GLP-1 medication like Ozempic, Wegovy, and Mounjaro mimic this natural hormone, but with a twist. They stay in your system longer and act more powerfully. That means less hunger, slower digestion, better insulin control, smaller portions naturally, no willpower wrestling matches at midnight. There were several clinical trials that have proven the efficacy of these medications. The first one is STEP 1 trial 2021. Semaglutide users lost up to 15% of their body weight. We are talking about 45 pounds in some people. The other study, SURMOUNT 1 trial, tirzepatide, up to 22.5% body weight loss. This by itself is the ballpark of bariatric surgery, but without a knife. And this is not just about appearance. GLP-1 helps reduce the risk for heart disease, stroke, fatty liver disease, and even improve mobility and sleep apnea. So when people say it's just a skinny shot, I would say it is a metabolic game changer. Okay, now let's talk the real talk. What are the side effects and who shouldn't take these? There are common side effects like nausea, vomiting, diarrhea or constipation, heartburn or bloating, and finally fatigue, usually early on. All these common side effects can improve in few weeks. Starting with low dose and slowly increasing helps minimize them. But there are rare and serious risks like pancreatitis, inflammation of the pancreas, gallbladder issues like gallstones or inflammation, and possible thyroid tumor risk in rodents, still unclear in humans. These medications are not for people with history of medullary thyroid cancer or MEN2 syndrome, any GI disease like gastroparesis, pregnant or breastfeeding women, and for anyone who is unwilling to commit to medical follow-up. These are not miracle drugs. They are prescription medications that need careful monitoring. So Sarah started on semaglutide, Ozempic. We titrated her slowly. Nausea in the first 2 weeks, but she stuck with it. At the first 3 months, she was down 18 pounds. Energy up, no more sugar cravings, labs improving. At 6 months, she was down 37 pounds. A1C in normal ranges, triglyceride down, and for joint pain is all gone. But there is something else happened that is even more important. Sarah said, I feel like I have control again. For the first time in 20 years, I'm not obsessed with food. Here's what we'll need to learn from Sarah's journey. Obesity is not a willpower problem. It's a medical condition, and we now have tools to treat it. Number 2, GLP-1s are not magic, but they are powerful. Combined with lifestyle, they can create real sustainable change. Number 3, shame is not a treatment plan. Science is. And most importantly, there is no one right way to lose weight, but there is a right way to approach it with empathy, science, and support. If you have been struggling with your weight, I want you to know you are not weak, you are not lazy, and you are not alone. GLP-1s are not for everyone, but for some, they are the breakthrough they have been waiting for. Talk to your doctor, do your research, and always ask questions, because knowledge is power. If this video helped you, share it with someone who needs to hear this. Hit that like button to boost this message, and subscribe for more evidence-based, no BS medicine right here at Dr. Nony's Power Lab. We do real science for real life. See you next time. Thank you. Bye-bye.